Hello, friends. This is teacher Dentist Sam Soni, and today's topic is botulinum toxins and dentistry. So, I'm going to review an article by Professor David Mock, professor from University of Toronto, and this is an article published in the Peak series by RCDSO, and it was dispatched in December 2009. So, let's get right into it. So, botulinum toxin, as seen here, is commercially available botulinum toxin, which is actually purified exotoxin of anaerobic bacteria. Can you guess the name? It is Clostridium botulinum. So now Clostridium has another brother, if you guys might remember. That was Clostridium tetani, right? Just to brush up our concepts, Clostridium botulinum and tetani have a few distinguishing features. Botulinum causes a flaccid type of paralysis, while Clostridium tetani causes a spastic paralysis. The difference between flaccid and spastic is that in flaccid paralysis, the muscles lose their ability to contract, while spastic type of paralysis has unusual tightness of muscle. So, botulinum also causes a very common disease which is called, any guesses? Botulinism. Sorry, botulism. While Clostridium tetani causes a very well known condition known as, of course, the name suggests, tetanus. Just so you guys know, this is not tetani. Okay, tetani is a different condition. This we are talking about tetanus by Clostridium tetani, and Clostridium botulinum causes botulism. So that was okay. Now, how many types of botulinum toxin are available in the market right now? So basically, there are two types: type A and type B. So if we talk about down in states, the Food and Drug Administration has only approved botulinum A for treatment of cervical dystonia. Cervical dystonia is a severe neck muscle spasm. The other one is severe primary axillary hyperhidrosis. Which is actually excessive axillary sweating. So some people have complained of excessive axillary sweating, so they might use this kind of botulinum toxin. The next one is blepharospasm. Blepharospasm is a spasm of eyelids. So some people have their eyelids spastic movement there all the time. And of course, the aesthetic use for the severe to moderate glabellar lines. These are the lines just between the two eyebrows, and sometimes people have this 11 o'clock appearance on their forehead all the time. So if somebody has this kind of appearance, a small Botox dose is injected right there, and this will result in like flattening of that glabellar lines, and the person would actually look probably younger or more aesthetic. And according to the US Food and Drug Administration, type B is only approved for cervical dystonia. Now I can go on and explain why, but not right now. Those who are going for boards might throw this as a question, but those who are for AFK, this type A is the only approved one. Type B is not approved by Health Canada. And funny enough, the most publicized application has been for aesthetic purpose like that, removing those facial wrinkles and glabellar lines only. Okay, and that is accomplished by paralysis of subcutaneous mimetic muscles. So let's see how does it actually work. Yes, you said it would cause elimination of facial wrinkling and glabellar lines by paralyzing the subcutaneous mimetic muscles. But how? That's a question. So let's see how it works. So normally the toxin, so normally normally for contraction of any muscles, the axon terminals will release a chemical messenger called acetylcholine from the presynaptic vesicles, right? But when you inject Botox or botulinum toxin, then it stops the conduction of those nerve impulses or transmission of acetylcholine from the axon terminal towards the muscle. What will happen then? This muscle is going to stay flaccid. A muscle which is not contracting will be a flaccid muscle, right? But this effect only stay there for say 3 to 4 months max. After 3 to 4 months, so what will happen after 3 to 4 months? This either two things can happen. Either this blockade will be removed because there would be no more botulinum toxin available, or mostly, as Dr. Mock says, that uh, there will be new uh, axon terminals. There will be sprouting of new axon terminals, which will result in communication starting again. So overall, we can say that the life of every Botox injection would be just 3 to 4 months. So that's why we conclude that it is not a treatment for any wrinkles or conditions. It is rather just palliative or symptomatic. Now, other than the causes that we discussed before, these toxins are also useful for some orofacial pain to provide temporary relief for those orofacial pain. Or sorry, I should correct myself. It should be orofacial conditions. Okay, so but still there are more research being going on, and this is still in process to be confirmed. Author also go ahead and say that there are rarely any adverse reactions. Worst case, if there is any, it is near the injection site, and like it may include dry mouth, dysphagia, dysphonia, transient muscle paralysis, headache, urticaria, and nausea, which is probably expected in any injectables. So you would see if anybody go for Botox, like they would always, the commercially available Botox A would always have a warning that it can cause potential adverse effect, and even the providers should inform the patient before the treatment begins. But other than these usual side effects, the warning label also mentions that this can cause some severe botulism-like symptoms, such as These can be loss of bladder control, difficulty breathing, dysphagia, dysphonia, blurred vision, and drooping eyelids. And honestly, this can start from maybe immediately or few days after the treatment or several weeks after treatment, and also at unrelated sites. So just we know that adverse effects, very serious adverse effects, have occurred at therapeutic and even lower than therapeutic doses. It can also cause death, as reported in some studies that Dr. Mock has published, and children treated for spasticity seems particularly susceptible for adults, but adults haven't been affected yet, so it's more dangerous in children. Next, we will talk about TMJ disorders. So they are usually collectively a collection of symptoms which involve masticatory musculatures, TMJ joints, and associate structures. They are often intermingled with many disorders like chronic fatigue syndrome, fibromyalgia, and uh, tension types headaches. Now, these patients are in pain, right? But there, it has been observed that if you inject botulinum toxin in these musculatures or near the joint and associate structures, then these symptoms are usually able to manage that orofacial component of the TMJ disorder. It is not going to treat it, but it is going to manage the orofacial or painful component of the TMJ disorders. But just so we know, this is not the only treatment. This is actually just an adjunct. First line of treatment will be uh, physiotherapy, of course, exercises, some behavior therapy, some oral appliances, and medication. Medications may include anti-inflammatories and muscle relaxants and analgesics or combination of all these. There is rarely any surgical intervention, but uh, botulinum toxin has been a useful adjunct. So our botulinum toxin is actually has been a useful but only as an adjunct, particularly when these have failed to provide adequate relief. But still, for dystonia, masticatory muscle hyperfunction, myofascial pain, and sometimes even bruxism, these conditions can be uh, alleviated or at least improved by the use of botulinum toxin. Now, Professor Mock also mentions that some say that it is also useful when doing the TMJ surgery as a supportive therapy, but not much research on it, so we don't have to stress on it. Now, for other disorders, as we already said, that there is still enough work has to be done in this area. It has also shown improvement in headaches, migraine, and tension type symptoms, right? So, of course, we said the glabular lines come after tension only, so it relaxes those glabular lines. Maybe it also, maybe, I believe, not believe, I think that maybe it is related with that part, but there are still researches going on, so we still need to work more on the research side before prescribing it or injecting it into our patients, and of course make them read the label, make them know that what will be the side effects, potential side effects of this injection. So other than migraine and headaches and tension, in sialorrhea, funny enough, in sialorrhea It has been seen that if you inject the botulinum toxin directly into salivary glands, usually with electromyographic guidance, it has suggested to reduce the load of newly placed implants. How it works is, during sialorrhea, there is excessive saliva production, right? So that means there is a high neuromuscular activity happening or high acetylcholine being released and stimulating the gland. So this botulinum toxin is going to stop that activity, hence it will reduce the saliva secretion for up to some extent, and this might help to reduce the load on a newly placed implant. But again, this is not a very well tried. There is no well tried evidence for it. Also, it does not affect significantly the success of implant. The other not too popular, as I said, other right here, not too popular one is the perioral region. So I have seen doctors using dermal fillers for those, but some people say even Botox can remove wrinkles from perioral region. But again, this is not being proven and something we should not rely on. So, as a summary, botulinum toxin and dentistry. It is a purified exotoxin of anaerobic bacteria Clostridium botulinum. It causes a flaccid paralysis, loss of ability to contract, and this bacteria usually causes botulism, but not with the Botox. Okay, just so we are clear. There is type A and type B. The type A causes cervical dystonia, severe primary axillary. So it is used in treatment of cervical dystonia, severe primary axillary hyperhidrosis, blepharospasm, and aesthetic moderate to severe glabellar lines removal. Then we saw how it works by inhibiting acetylcholine release from the axon terminals, causing a flaccid muscle. It is not a treatment, it is only palliative or symptomatic. So if somebody says what is a treatment for a condition like TMJ disorder, you will not say that this is a treatment. This is only going to be used as an adjunct. Side effects include dry mouth, dysphagia, dysphonia, headaches, urticaria, nausea, botulism-like symptoms, loss of bladder control, difficulty breathing, blurred vision, drooping eyelids. When we are talking about TMJ disorder, it can involve masticatory, musculature, TMJ joints, or associated structures. And it is also a very complicated disorder which may include or show intermingling symptoms with chronic fatigue or headaches or fibromyalgia. So the treatment for TMJ disorder treatment is always physiotherapy, exercise, behavior, oral appliances, and meds. Botox, or I keep saying Botox, but botulinum toxin use is adjunct. Other kind of applications may be in headache, migraine, tensions. As we said, this is not proven. Sialorrhea, when there is excessive saliva production, especially during implant placement, because it is a short-term thing. It is not going to be a treatment for sialorrhea, but during implant, it may reduce loading of the implant. Again, not proven. And perioral region linkal, not proven. That's all. Thank you for staying with me for almost 19 minutes. This was Teacher Dentist. Please watch rest of our videos. Thank you. Bye-bye.